Hello everyone, welcome back to my YouTube channel. This is Annie the Pharmacist, back with part 2 of kidney disease, and this is called chronic kidney disease, also known as CKD. That's the acronym. Now, what are the kidneys? As you're looking at that picture, they are two bean-shaped organs about the size of your fist. So if you were to make a fist, that's the size of your kidneys. What they do is they remove natural waste products and extra water from your body. They also help in making red blood cells. They balance important minerals in your body, and they help to maintain your blood pressure. They also make vitamin D, and that helps to keep your bones healthy. Now, when your kidneys are damaged for 3 months or more, that's when it's classified as chronic kidney disease. Then it increases your risk for heart disease and stroke. The signs and symptoms that you can look out for is you will be urinating less. So you have the urge to go to the restroom more, but when you go, the urine output is less. Your urine is usually foamy, so foamy like soap suds. Your skin could be itchy or dry. You're feeling more tired than usual. You have nausea, a loss of appetite. You start losing weight without even trying, and that's in the more advanced stages of chronic kidney disease. You have trouble concentrating. You can have trouble sleeping, shortness of breath, vomiting, achy or crampy muscles, and numbness. Um, and your breath can smell like ammonia, and that's an awful smell. Some people described it as smelling like urine or fishy. Can you imagine walking around with your breath smelling like urine or smelling fishy? Some of the causes are diabetes, high blood pressure, heart disease or heart failure, obesity. Again, that's when you have on too much weight. If you're over the age of 60, family history of chronic kidney disease, smoking or the use of tobacco products, your glomerular disease. So if you have a glomerular disease, that's for example, a glomerular disease would be like HIV nephropathy. So nephro again is kidney and pathy is just a disease state. So HIV nephropathy, that's a diseased kidney caused by HIV. Um, if you inherit the disease, like polycystic kidney disease, and polycystic is just poly means many, and cystic that's the cyst. So many cysts on your kidneys, and you could inherit that from a family. Um, Autoimmune conditions like lupus, nephritis. So itis again is inflammation, and nephro is kidney. So a lupus nephritis kidney. If you have severe infections, for example, sepsis, and sepsis again is a serious condition that is bacteria in the blood. So your blood is supposed to be sterile. So no bacteria should be getting in your blood. Um, Kidney cancer, kidney stones. If you have a urinary tract infection that goes untreated for too long, that could also cause chronic kidney disease. Now, some of the complications that you could suffer from this is cardiovascular disease, which is basically just heart disease or stroke. You could start having high blood pressure, anemia, which means the red blood cells are low, the levels of your red blood cells are low. You could have metabolic acidosis. That's another complication, which just means that there's a buildup of acid in your blood. As I say, you want the blood to be pure. You do not want buildup of anything in your blood. No acid, no bacteria getting in, anything like that. Ironically, it could cause acute kidney failure. So the chronic kidney disease also causes acute kidney failure. Um, Also, You could have mineral and bone disorder. Remember that the kidneys also help to make vitamin D. And if your electrolytes, which are like your calcium, your phosphorus, your magnesium, if all of that is out of balance, then that's when you're having issues. Hyperkalemia again. Hyper means high. The kalemia, the K in the potassium, is from their periodic table in chemistry. That is, an emia is blood. So that's just high potassium in the blood. All right. So, what with regards to treatment, if you remember in my last video, I even discussed ACE and ARBs, and I showed you an example of an ACE, and there are several, lisinopril, all those prills, ramipril, but they help the ACE and the ARB, and the ACE is angiotensin converting enzyme. That's an acronym for that. The ARB again is an angiotensin 2 receptor blocker. They help to treat the kidneys. You have another group of drugs called the SGLT2. These are diabetic drugs. They help in lowering blood glucose. So they are also going to be used in diabetes to help lower your blood glucose as not to get into chronic kidney disease. There is another set of drugs which are the acronym again is NSMRA. I know it's a long one, but it's also a non-steroidal mineralocorticoid receptor antagonist. So that's a mouthful. Non-steroidal mineralocorticoid receptor antagonists. And what these do is they help the glomeruli to stay healthy and help lower your urine to albumin, urine albumin to creatinine ratio. Now I will explain for those who do not understand. What glomeruli is, they are small filters in your kidney. So what these drugs will do is help them stay healthy so they can help lower your urine albumin to creatinine ratio. Okay, your urine albumin, what albumin is your protein. That's blood protein. And that's one of the most abundant protein in your blood floating around. It's called albumin. No, you do not want to lose that. Too much of that coming out in your urine. What the creatinine is, your creatinine is basically a waste product that comes from the digestion of that protein in your food and the normal breakdown of muscle tissue. So when your muscle tissue breaks down or the albumin breaks down from digestion of protein, right? That is when you get a creatinine. So creatinine is basically just a waste product of protein, right? Now, your nutrition, you have to limit your salt intake. You have to watch how much potassium, how much phosphorus, how much calcium you get through diet. You have to stop smoking. You have to exercise. You have to reduce or manage stress. You have to lose weight if you are overweight. You have to stay away from NSAIDs. So you're not going to want to have chronic kidney disease and then you take more drugs that is going to make it worse. And these are NSAIDs. So, for example, ibuprofen, again, naproxen, diclofenac. I know in other countries, diclofenac, they call it cataflam. Here in the US, diclofenac, we call it Voltaren. That's our brand name. But in other countries, the brand name is Cataflam. So if you hear them say Cataflam, it's still diclofenac, and it's an NSAID. Celecoxib, brand name here in the US is Celebrex. Meloxicam, also called Mobic. Now, with aspirin, if you have chronic kidney disease and you take a 81 milligram aspirin a day or 325 aspirin a day, that is okay. But if you are going to take more than that, that's a no-no for you, because remember, aspirin, if it's not being filtered out properly through the kidneys, you will be at increased risk for bleeding. And that's the last thing you want. Now, um, dialysis is necessary. So that's like last resort now. Well, not last resort, because you still have kidney transplant, which is the last resort. But dialysis is necessary when your GFR, that's the same glomerular filtration rate that I mentioned earlier, is less than 15%. And what this means is that your kidney function is less than 15%. So that is how well your kidneys filter the blood. So if it's filtering it less than 15%, that's when you have to go on dialysis. Kidney transplant, which is your last resort. This is when you are basically planning to spend a lifetime on dialysis. So it's so bad that you're spending a lifetime on dialysis. That's when you have to look for other options. And your other option would be if you could get a kidney transplant, right? That's when you cannot function without dialysis. So you have to be on dialysis constantly. That's when you look for, try to get a kidney transplant. Now, as we always say, prevention is better than cure. Take care of those kidneys. Hydrate properly. Lose weight. Exercise. Do everything healthy. Watch your diet. So, lifestyle changes is always the best. Please like, subscribe, and share. Don't be selfish. Someone could learn something from this video. Thank you and have a great day.